Welcome to the Medical Marijuana and Wellness Seminar. Tonight's topic is cancer, chemotherapy, and medical marijuana. Cancer is something that affects, unfortunately, too many people. In preparing for this webinar or seminar tonight, I ran into a grim statistic that 1 out of every 3 people in the United States during the course of their lives probably will be diagnosed with cancer. So obviously, this is something that affects a lot of people and something that is of a lot of concern. Joining me tonight are a couple of folks that are going to help me with this particular webinar. First of all, I'd like to introduce Forest Haag. Forest is from Surterra, and thank you very much not only for sponsoring, but you have some particular insights that you'll be able to help us with tonight.
Hey, Mark, we do. Hi, everybody. My name is Forest Haag. I'm the product marketing manager down here for Surterra Wellness in Florida. We're excited to be here tonight. With me tonight, I have one of my favorite store managers, Manny. I'll let him introduce himself as well. And yeah, we'll be talking about some great products and options and things around some of the symptoms that people are dealing with.
Great. And Manny, are you there? Can you introduce yourself, Manny? I don't know if we lost Manny there for a minute. Well, in the meantime, I'd like to introduce someone who helped me put together the video that you're going to see tonight, and someone who's helped with quite a few of these seminars and has some experience in working with patients with cancers. Amy Green, who's a nurse in the MMTC clinic in the Villages. Amy, say hello.
Always great to be here, Mark. Thank you for having me.
Good. I appreciate all the help that you've been doing. I think we lost Manny there for a minute. But what I'm going to do is I'm going to actually just cut right to, hold on. Oh, there you are. Manny, how are you doing?
Good evening. Sorry about that. I'm doing great. Thank you for having me. I am the store manager at the Pensacola location, and I'm here to assist and answer any questions regarding some of the treatments or remedies for the symptoms of treatments from cancer and other issues. So I'm glad to be here. Thank you for having me.
Right. And this is a very important subject. So let's get on to it. We have a video that we produced in preparing for this. And then after that, what we'll do is we will then go to, we'll talk about some actual products that can help you with cancer rather than just theory. And then we'll answer your questions. So we're going to get right into the video. And again, thank you everyone for joining us. Welcome to Medical Marijuana and Wellness. Today's topic is cancer, chemotherapy, and medical marijuana. Joining me today as guest speaker is Amy Green. Amy, you're an RN with MMTC. Please introduce yourself.
Yeah, thank you, Mark. It's always great to be here. So my role at MMTC is I do a lot of patient education with both new or experienced cannabis users. So we really drill down into what they're going to be using cannabis for and what areas of education they're lacking in, and see how I can help them.
Well, I'm sure you've helped a few cancer patients, and so let's talk about cancer. I know there's 100 different types of cancer, but Amy, what is it? And then once we understand what it is, let's talk about what medical marijuana can do to address it.
Yeah, certainly. So there are well over 100 types of cancer, and cancer is a group of diseases that involves the abnormal growth of cells. And those cells have the ability to invade or spread to other parts of the body. Now, this is in contrast to something like a benign tumor, which does not have the ability to spread. Now, there are some basic characteristics of what would constitute a malignant tumor. So it's cell growth and division that is absent the proper signals. And those signals would tell that cell to grow at a specific rate and to die at a specific rate. When you have a malignant tumor, those signals are not getting through, so the cell is growing at an uncontrolled rate, it is dividing at an uncontrolled rate, and it's also forming and producing its own blood supplies and blood vessels. So when you have metastasis, it is that those cells spreading to a different area of the body. So it's
that whole process is actually draining the body and of its energy. That's basically what you're doing. You see it as a number of symptoms that are there. What's interesting is medical marijuana has really come a long way as far as our understanding of it. There's something called a ceramide, which I think cannabis really addresses.
It does. So cells normally have a low level of ceramide, and as the cell ages, that level of ceramide rises. High levels of ceramide contribute to cell death. It's what prompts the cell to go into apoptosis or to cell death. When cannabis or THC interacts with healthy cells, it's not going to change the ceramide levels. But when THC interacts with the CB1 or CB2 receptors of these cancer cells, it's actually causing an increase in ceramide, which drives cell death.
No, that's very, very important. We'll see that in just a moment. So how does cannabis fight cancer?
Yeah, so there's a couple different ways that THC and CBD can target cancer. The first is it's going to cause programmed cell death or apoptosis of those cancer cells. It's going to help inhibit the proliferation or spread of those cancer cells. And it's going to slow tumor growth by preventing the formation of new blood vessels that those cancer tumors need to survive. And then finally, it can help stop the metastasis or the spread of cancer to other parts of the body.
Right. And a lot of this research has been done outside the United States because here in the United States, it's a Schedule I drug and there's no research being done or very little research being done. But really Israel, Spain, and Canada has done a lot of research. So let's see exactly how this works. Let's look at some videos on how these killer T cells work.
The green cell you see here is a killer T cell of the immune system which is attacking the cancerous red and blue cell. You can tell when the killer cell has recognized the cancer cell because the two dots move around and contact the target. The killer cell then spreads out over the cancerous cell. Passing the video through a filter makes the killer cell look yellow and allows us to really see how it focuses on the cancer cell. These killer T cells are constantly hunting down dangerous cells throughout the body and destroying them.
You know, it's interesting that there is a lot of research being done on killer T cells. And the best way to produce them in your body is a very healthy way by using medical cannabis. So what research has been done out there? How do we really know this really works?
Yeah, so a lot of the research that has been done has been more focused on the symptoms that are caused by either the cancer itself or as a side effect of the chemotherapy, radiation, or other therapy that the patient may be having. And so those studies are usually targeting pain, nausea, and weight loss. But beyond just the physical relief that medical marijuana can offer a patient, it has really great psychological benefits because as they are not experiencing that pain, nausea, or they're not losing weight, they're feeling better, which is just great for feeling great when you're happy.
Yeah, I think it addresses a lot of the anxiety and the stress that people are getting when they have cancer, which obviously is something that comes part and parcel with it. But also these studies are showing how it affects tumors.
Absolutely. So it can help with shrinking existing tumors or slowing the growth of some cancers as well.
Right, and that's very fascinating. So if you take a look at the various symptoms and you take a look at the difference, again, this is a study by the National Cancer Institute. They found it really medical cannabis helps in a number of different ways.
Yeah, absolutely. So the big one is that we know about is cancer is a really great at interrupting the signals that are sending pain throughout our body or signaling pain throughout our body. So it is an analgesic, which is pain reliever. It's also opioid sparing, meaning that it's not interacting with those opioid receptors in the body. You have quality control, administration, and dosing. All of these things are super important when you're considering using cannabis for chemotherapy-induced nausea or vomiting.
Yeah, and I think also, I think you look at it, how it really complements, how should I say, since complements really works to get rid of and or manage a lot of the symptoms that people are getting are the byproducts of chemotherapy.
Yeah, absolutely. And of course, those big ones, are chemotherapy-induced nausea and vomiting, but you can also have a lot of pain that's caused by either the cancer itself or the chemotherapy or radiation that the patient is receiving.
Right. And also cannabis can help a lot with helping you sleep, which is important for patients that are in any condition that's being attacked or any medical condition, as well as it affects your mood, which again is a major part of the whole cannabis experience, as well addressing cancer. Now, let's also look at what's interesting is when they did some studies. Again, this is the National Cancer Institute. Sometimes more is not better. They took a look at how much THC a patient needs. Now, every person has their own optimal therapeutic dose, but once you find that, going to that particular point helps to combat cancer. But when you go beyond that, it really doesn't really get rid of the pain. Why don't you explain that a little bit?
Yeah, so when you are finding a therapeutic dose, the idea is you want to use the lowest amount possible to receive the effects that you're looking for, but without unwanted side effects. And when using too much cannabis, you can start to have unwanted side effects, that stoned, heady feeling. Some people may have a return of the pain, nausea, or vomiting that they were trying to treat in the first place. But yeah, as you said, more is not better when it comes to cannabis. It's about finding that sweet spot that you have the relief that you want, but without unwanted side effects.
Right. And every person's body is different. This is one chart of some studies that was done. But I think it's important to point out your body will tell you when you find that optimal therapeutic dose. You don't need a doctor to tell you that. Your doctors will help guide you in that particular direction. There, you can see here that there's some windows of, let's just say, of dosage, but your body will be the thing that you need to listen to. It will tell you when you get to that particular point. Now, let's talk about some research that has been done. One of the people that I really like is Dr. Cristina Sanchez. She's in Spain. In 2002, I underline the word 2002, Spain actually built her a facility to do research into medical cannabis and cancer. And she's been doing a number of studies for a number of years and produced a number of studies that are out there. And she's also put together a complete cannabinoid profile. She calls it the entourage effect. Another researcher that's been doing a lot of work is a gentleman named Rick Simpson. He created something called Rick Simpson oil, or it's called RSO, and sometimes it's called FSO, full spectrum oil. And what he found out was he was trying to treat his own cancer, and he found out that high concentrates of this actually reduce the amount of cancerous growth and actually cause them to disappear. This is something that's been very, very interesting that's out there. And I think, Amy, you can find RSO in almost every dispensary.
Yeah, absolutely. And as you said, some companies will call it FSO, full spectrum oil, but it's really just taking the entire plant, kind of smushing it all together, and you get this very concentrated full spectrum product. So it has all of the original terpenes, flavonoids, and cannabinoids of that original plant, just smushed down into this very sticky, resinous substance that is excellent for pain control, for nausea. You can use it topically, or you can use it orally or sublingually.
Sure. And it's interesting, over the years, he contributed this to the whole world. He doesn't charge anyone if they want to copy his formula, but there's been thousands of testimonials of patients that have had positive experiences using RSO. There's, again, going back to some research that's been done, this is one of the studies that's very interesting about studies where they've used cannabis and found that it was very effective.
Yeah, and so this was actually looking at 207 preclinical articles. So of the articles that were reviewed, about half of them, it contained original data and were not simply reviewing previously collected data. So of the 77 unique case reports described, patients were having various cancers, including breast cancer, lung cancer, leukemia, prostate, pancreatic cancer. And about 10% of the cases were in pediatric patients. Now, they showed that about 14% of the cases reported were considered strong, 5% were considered moderate, and the remaining 18% were considered weak. And that's actually just them looking at the strength of the evidence that was collected in those particular papers. But the thing that kept coming up was that using cannabidiol, which is CBD, as an anti-cancer agent in a dose anywhere from 10 to 800 milligrams, or delta-9 THC in ranges from like 4 to 7 milligrams, these two areas are very helpful. And so you have separate studies identifying benefits of cannabidiol or CBD, and then separate studies looking at THC. But there's really not many studies right now that are looking at both of these compounds together for the
Yeah,
treatment.
I think in a lot of the research that's been done, a lot of the researchers were actually smoking cannabis as opposed to using the tinctures, the oils, and the concentrates. And so what they're doing right now, I know a lot of the research that's being done on cancer and medical marijuana also are using other routes of administration. And we'll talk about that in a little bit. But there is a lot of research that's out there, and the research that's been done has had all, let's put it this way, points to the same thing, that it really, really helps. Let's talk about the status of research in both the United States and other countries.
Yeah, so the biggest thing in the US is obviously cannabis is still a Schedule I narcotic, as listed by the DEA, the Drug Enforcement Administration. So currently, there is not a way for companies, whether it's pharmaceutical companies or universities, to have these trials in the US that focus on cannabis, just because it's not allowed. A lot of our research is coming out of Spain, Israel, the UK, Canada, and there's actually a lot of it coming out of China as well right now.
Yeah, I found that very, very interesting. But the bottom line is there's been thousands of testimonials that show that Rick Simpson oil has helped a number of people. Here in Florida, licensed dispensaries carry RSO or FSO, which I think is very important. And also cancer here in Florida is one of the qualifying conditions to get a medical marijuana card, not just in Florida, but in other states. Cancer seems to be one of the qualifying conditions, and it's something to really pay attention to. So cancer and medical cannabis really go hand in hand. So the question is, why is it such a big deal? I tend to look at cannabis as a whole medicine cabinet. It has 450 medical properties, 120 cannabinoids, of which we have 6 of them shown over here, 100, and it has over 100 different terpenes. The terpenes really give the medical efficacy of the product. But when they work together, it provides something called the entourage effect. Give us a quick tip as to what the entourage effect is, Amy.
Sure. So it's when you combine all of the different parts of the cannabis plant. So you have all of the cannabinoids, including major and minor cannabinoids, all of the terpenes, and then all of the flavonoids. So the terpenes and flavonoids give cannabis its smell and its taste, and they're really driving a lot of the beneficial effects that patients actually receive from cannabis. So when you put all of these things together, you have the entourage effect, or how they are working in combination with each other.
Sure. And so when you take, and this goes into what you were talking about here, again, you get the terpenes, which are bringing a lot of the flavor, the aroma and the taste, but also the flavonoids combined with the cannabinoids, really putting those together, and so many of them, is really what makes cannabis unique. It has a lot of medical properties, and by combining them and using them in concert, it helps to address a lot of different medical conditions. That's why cannabis is really so effective. If you take a look at, again, putting those together, it helps to be able to create what they call the entourage effect. In other words, 1 and 1 is 3. Examples, Amy, are like CBD that really helps lessen the psychoactive effect of THC.
Absolutely. And it's just the same. Terpenes help enhance the medical effects of cannabis. And then when you combine THC and CBD together, you really get some powerful benefits. Like CBD on its own is a great anti-inflammatory, but combined with THC, it's really great for anti-inflammatory and pain, and they work better together.
Sure. So the question is, why is it such a big deal? Why is cannabis such a big deal, and why are we hearing so much about it? Well, for centuries, we heard about the nervous system. This is where if one part of your body has some sort of a problem, you hurt your finger, you hurt your knee, you hurt your foot, it sends a signal to your brain and says, Houston, we have a problem. The question has always been, what does Houston do about it? What we found out when we started studying medical cannabis is our body has an endocannabinoid system. Everybody has it, and any mammal has it. So dogs, cats, as well as humans have this. But the endocannabinoid system is interesting because this is where your body manages pain, anxiety, memory, inflammation, your appetite, your immune system, and it helps your body stay in something called homeostasis. Now, let's talk about homeostasis for a moment, because homeostasis is your body in balance. What your body wants to do when you say, I feel good, your body is in balance. And that's because your endocannabinoids are producing the natural medicine it needs to be able to address the situations that are coming up in your body. Now, phytocannabinoids are produced by the cannabis plant. Amy, why are they such a big deal?
Yeah, so they are structurally identical to the cannabinoids that are naturally produced by our body. And so when you introduce phytocannabinoids from the cannabis plant into our body, it is actually supplementing the system that we naturally have. So that way it can help, with the different processes of pain control. It is helping with immune response. It's helping with all of these different systems throughout the body by just supplementing our naturally occurring system.
Right. And I know that you wonder, why would you use phytocannabinoids? Well, for example, I'm a senior citizen. My body doesn't produce as much or as fast of the endocannabinoids to address any of the problems that it might have. But by having the phytocannabinoids in our body, in essence, it's like recharging our battery, giving our body the resources it needs to be able to keep us in homeostasis. Now, we have a couple of well-known cannabinoids, THC and CBD. Amy, what are they?
Sure. So THC is the most commonly found product in the cannabis plant. This is what gives cannabis its psychoactive effects, but it's also producing a lot of the non-psychoactive benefits as well: pain control, immune response. And it's mostly going to be interacting with the CB1 receptors, which are in the brain and the central nervous system. And then you have cannabidiol, or CBD, which can be found in low levels in low levels in cannabis, and that's also found in hemp. So this is the non-psychoactive part of the cannabis plant. And this actually interacts mostly with the CB2 receptors, which are found in the peripheral organs and the immune system throughout the body. So when you put these together, you're actually interacting with so many different systems throughout the body. And that's really where a lot of the benefit comes from.
Right. And it's interesting to point out that if you find a plant that has 0.3% or less of THC in it, that's referred to as hemp. That's the definition of hemp. Now, let's talk about how all this works together. We talked about the entourage effect. This is a great slide. Now, this is just some of the cannabinoids. As I mentioned, there's 120 of them that we know about. But just taking some of them, you can see where, for example, if you're trying to address sleep, there are different properties in each of the different cannabinoids that help with sleep. Same thing with inflammation, same thing with pain, and same thing with cancer. This is a pretty good illustration of how putting the CB1, the CBD receptors, the THC receptors and their families together really produced what I call that entourage effect.
Yeah, and it's just putting those different parts together. Like you said, it's great because you're having these individual pieces that are coming together to address these specific effects.
Right, and you can see by the coloration here where the CB1 receptors are and the CB2 receptors throughout your whole body. But you can see how they all work together. This is the benefit. This is really the magic of cannabis that we're seeing right here. Now, the effects it has on the body is interesting because THC and CBD address the CB1 and CB2 receptors. And as you mentioned earlier, Amy, the CB1 receptors look at the immune system or address the immune system, peripheral organs. CB2 is inflammation, immune response, and peripheral nervous system. But CBD has actually another characteristic to it where it works with receptors outside of the CB1 and CB2 receptors. It acts like a supervitamin.
It does, yeah, and that's why it's really cool. Like, it can interact with the 5-HT receptor to help regulate serotonin levels, which are part of your digestive process, your blood flow and blood pressure, and then your breathing. It can interact with the A2A receptor, which is part of your inflammation response, your VR1 receptor, which help regulate body temperature and pain, and then the GRP55 receptor, which is part of regulating blood pressure.
Right. And these research studies are actually finding that it's affecting even more receptors, meaning it's bringing a healthy response to your body, putting it back into or helping it maintain homeostasis. Let's listen to Dr.
Well, my name is Cristina Sanchez. I'm
appreciating.
a professor of biochemistry at Complutense University in Madrid, Spain. And I have been working, studying the anti-tumor effects of cannabinoids for the last 15 years. Regarding the amount of THC and CBD that a cancer patient has to take in order to cure his or her cancer? Well, first of all, we don't know if cannabinoids cure cancer because we don't have clinical control studies saying that. We know that they work as anti-tumoral agents in preclinical models of cancer, and we have a lot of anecdotal reports from people saying that they have cured their cancers with cannabinoids. But from the medical community perspective, we don't have that evidence yet that cannabinoids cure cancer. But going back to Dennis's point regarding the ratio of THC and CBD that one has to take to cure a cancer, I wouldn't say that a 1:1 ratio is the need. I would say that each individual, each patient needs a particular ratio of cannabinoids, or at least that's what we have seen in our preclinical models of cancer. Not only us, but the rest of the research groups that are working on this field. What we see is that some types of tumors, for instance, glioblastoma, brain tumors, in these cases, more THC works better than a 1:1 ratio. On the other hand, in breast cancer, which is the type of cancer in which I work, we have seen that more CBD works better than a 1:1 ratio. So I would say that, and this is the case for other medicine, other anti-cancer medicines, each patient is a different situation, is a different clinical challenge. So I wouldn't say that a 1:1 ratio would work for everyone.
I think, again, that's really important because Dr. Cristina Sanchez has done a lot of work. Has done a lot of work in this area. And what she's actually finding out is that it's very personalized. This is where your medical marijuana doctor and your doctor should be working together. And candidly, listening to your body is really, really important. Certain cancers will address or will react to CBD, certain will react to THC, and it really is a matter of just actually trying the different products that are out there. Now, what should you try? Well, what's happening today in the cannabis world is that they're actually producing plants. They're genetically producing plants that are a combination of both the strains and the terpenes with the cannabinoids. And what's interesting is they're producing what they call cultivars. Cultivars are plants that are designed to have a certain, what they call chemical fingerprint, to do something. Now, we do know that RSO or FSO is something that really addresses cancer, and you can go to a local dispensary and find different RSO products, indica, sativa, or hybrid. What are the differences between them? Indica is more relaxing and calming. Sativa is more energizing. Hybrid is a combination of the two. But all of these working together will provide something that can really, really help you. And it's really a matter of really trying it. You will know right away if it's really working, meaning within a week. Try it a couple days, find what's happening, and what you're going to end up finding out is what will actually work for you, how much CBD you need, and how much THC you need. And you can actually vary that. And again, by using some of these FSO products, they bring the whole plant to the party, which really helps you quite a bit. So let's talk about terpenes, because I know here's the most important part of cannabis is really the terpenes and what terpenes you should use. Here are some of the terpenes that are there in some of the research that's been done. Amy, tell me a little bit about terpenes.
Yeah, so again, terpenes are what give cannabis its smell and its taste, and they're really driving a lot of the benefits of the actual cannabis plant. So from research, the most well-researched and identified terpenes that address cancer are going to be pinene, myrcene, limonene, terpinolene, humulene, and beta-alanine. Most of these are going to be major terpenes that you'll find in large quantities in most plants. Some of them are going to be more minor terpenes, such as the terpinolene or the beta-alanine. You'll find those in smaller amounts, but they can still be beneficial even in smaller amounts. Now, looking at the actual incidence of cancer in the US, I mean, the US is looking at like 1.7 million new cases of cancer every year, and almost 600,000 Americans die from cancer every year.
It's something that we really should be here in the United States. We should be paying attention to medical cannabis as well as T cell studies, because these working together we know are very effective in addressing addressing cancer. And we know that, again, cannabis is the most natural way to help the T cells produce within your body and address cancer. But these terpenes are really, really important. When you go to the dispensary, ask the person behind the counter what's in the product. Again, if you're using FSO, the free or RSO products, they'll have the complete complement of all of the terpenes. If you're looking at individual types of products, you may want to just make sure that these types of products, these terpenes are there to really provide the relief that you're looking for. And here's an example of and we're going to provide this, we're not going to go through this chart, but we're giving you a chart that really explains the terpenes, the effects, the cultivars it's found in, and the temperature at which it works within when you're using a cannabis device, especially for flower. Now, this is important. It's something that we're giving you so you can print it out. You can take a look at it. It'll be in the follow-up material. But it's really, really important to know that there's been research. We know that terpenes work, and we know that can be effective. Now, Amy, it's always interesting. People always say to me, well, maybe I should just go smoke a joint and it'll just work. There are other routes of administration. There's other ways of taking cancer. Let's start with flower. Let's talk about that. Let's go have a blunt and see if it works. Tell me a little bit about that.
Yeah, so there are lots of different ways that patients can use medical cannabis, and there are lots of ways that do not involve inhalation. So you have your sublingual route. That's usually going to be tinctures that you'll put under your tongue. You usually leave them in your mouth for a minute, swish it back and forth, and then go ahead and swallow it. Those can be very effective because you can get some onset, some action from them in just a couple minutes, and that's from the sublingual absorption under your tongue. And then you have products like sprays, very similar, very quick onset as well. Then you'll have oral products like capsules or edibles. These are going to take longer to take effect. And for these products, I always recommend that you make sure you're waiting at least an hour and a half to 2 hours before you take more, just to make sure you're giving it time to work before you take any more. And then you have—
and I think we should point out that onset means when I take it, how long before I begin to feel the effect of it. Duration is how long will it work. I know that sublingual drops are, again, in the category of 15 to 20 minutes and 4 to 6 hours, but oral products last 4 to 10 hours. But as you mentioned, they take a while to work. It may take up to 2 hours. And the famous thing about edibles, again, you get into the gummies, the lozenges, the brownies, the cookies. About the time you don't think they're working and you take another one is about the time it starts working. And that's where the famous stories of people taking too much cannabis come from. So really pay attention, especially with oral products. Be cool. Take your time. Wait an hour or two before you take some more because you just really don't want to take too much. As we mentioned earlier, too much THC isn't going to help you sometimes, but being able to find that therapeutic dose is really going to help you quite a bit. But in the case of cancer and in many pain conditions, topicals are pretty popular, aren't they?
Absolutely. And it's mostly because most of the topical products are going to be just localized relief to wherever you put them. So you wake up, your knee hurts, put some on your knee. It's only going to help your knee, and it's not going to give you any stoned, heady feeling at all. Now, some topicals do actually go into the bloodstream, and I would just say be aware of how much you're using then, in case you're using other cannabis products that are going to add cannabinoids to your system on top of that topical that is going into your bloodstream. I would always just make sure you ask at the dispensary if this will go into your bloodstream or not with topicals. And then you have transdermal patches. These are actually meant to be worn for anywhere from usually 8 to 72 hours. And they're very nice because they're going to give patients a low continuous dose for that entire period of time. And it is meant to go into your bloodstream though. So you just have to make sure that it is a dose that you're comfortable using.
Yeah, it goes not just on the skin, but also will penetrate through the skin into your bloodstream. And that's the difference between them.
Yes.
Now, inhalation is fun because a lot of people talk about, well, I'll just smoke a joint. And what they don't realize is when you take that blunt, take that joint, put that 500-degree flame up to that joint, you're burning off most of the cannabinoids, most of the terpenes, and most of the flavonoids. You're reducing the medical efficacy of that particular blunt or product down about 60%. That's the bad news. The good news is it still works. In other words, how can you run an engine sometimes at 40% and still get some effects? Flower will work, but there's a better way of taking flower. If you really want to inhale the product, that's where concentrates come into play. But then concentrates allow people to be able to, or allow the dispensaries to be able to produce a flower product in a concentrated version that protects and produces the terpenes. Tell us a little bit about that, Amy.
Yeah, so concentrates are available in many different forms. And once a patient is using concentrates, just like the name suggests, they are very concentrated forms of THC. But they're also going to have, depending on how the product is produced, it's also going to have all of the terpenes and flavonoids that that plant originally had. So at the point where you're using concentrates, it's just about picking the ones that you can work well with the texture and the effects work well for you as well.
Yeah. Because they come in shatters, they come in distillates, they come in resins, they come in butters, a lot of different things. You can either put them into a concentrate pen, meaning you can load them into the top of a pen. The pen usually has 3 or 4 different temperature settings to be able to bring out the right terpenes. Remember, we talked about we pointed out some of the temperature settings. The right temperature setting will bring out the terpenes. But also, you can actually dab it, and that's another way of actually just dabbing into it. And I'm not going to get too much into that right now. There's a routes of administration video that we did. Please pay attention to that or go back and look at that if you're looking at that type of route of administration. But I'm a big believer in concentrate pens rather than flower because it gives me the terpene profiles. It gives me the health benefits that are there. And if you don't want to load your own concentrate pen, you can actually buy a vape pen from the dispensary themselves.
Yeah, and as long as you're getting the vape pens that have a terpene profile, that's exactly what you want to look for. And some of the vape pens that you can get have terpenes up to 6, 7, up to 10%. So it can be very, very beneficial.
Sure. And so, by the way, I should point out, there's been some negative things about vape pens come out a couple of years ago. Those were vape pens that were not tested. They were not vape pens that had followed any certifications by either the state or the manufacturer itself. In fact, it was a third-party Asian manufacturer that came into the United States, sold into head shops. The products that you buy from state registered and licensed dispensaries have been tested twice by the dispensary itself and one by a third-party firm. So you're safe to use a vape pen from a dispensary. In fact, in many cases, it's something that really helps a lot of patients.
Yeah, absolutely, especially because the onset is almost immediate.
Right. And that's the key. I know I use it for pain, and it's amazing how fast it really helps me. So let's talk a little bit about dosing. I know that we talked about it earlier. We talked about, how much do you take? Well, every person is different. I know that when you take a look at alcohol or caffeine, in some cases in alcohol, some people can take, 1 drink and they're kind of done for the night. And some people can drink the whole bottle and just be getting started. But really, you need to find how much THC your body can tolerate. And you can do that by using what they call the therapeutic range. Tell me a little bit about dosing, Amy.
Yeah, so the biggest thing with dosing is you're trying to find that specific dose that works well for you, that's meeting your needs. So it's giving you the effects that you want, but without unwanted side effects. The unwanted side effect that most people are trying to avoid is that stoned, heady feeling. So ideally, we actually never want you to get to that point where you have that stoned, heady feeling, because we want to try and find that sweet spot before you actually get there.
Sure. And so the idea is go low and go slow. Start with a little bit of the product, try that out. Usually people will start with a one-to-one product, like a sublingual. They'll use like 0.25 milliliters, the first or second line on the dropper. Do that for a day or two. You may feel little or no relief. Then up the quantity. You'll begin to feel your relief from the effects or that condition, relief from the condition that's there. If you begin to use a little, as you up that dosage, what you're going to begin to do is you may begin to feel some of those unfavorable side effects. And when you do that, go back down. Once you go back, and again, if you have a one-to-one product and you find that therapeutic range that works, you can increase the amount of CBD. In other words, you can buy what they call a ratioed product. So rather than being 1-to-1, you could use a 2-to-1 or a 4-to-1. In the case of my wife, she uses a 9-to-1 and a 12-to-1, 12 CBD to 1 THC product to address her particular condition. Key, your body is going to tell you when you're in this particular range in here. No doctor is going to give you a formula. There really isn't something that really can help you with that. It's really unique to each individual person.
Certainly. The one thing that I absolutely suggest is journaling, keeping a record of how much you're using, when it's working, if it's working for the symptoms that you're trying to treat. And then if you would continue to use that product, you really kind of have to reflect on how it did for you and if there's anything that you would change.
Right. And by the way, we have a dosing video that's in our YouTube library you may want to check out. It can really help you be able to dial in. Dosing is the key to using medical marijuana effectively. So we've gone over a lot about cancer and medical marijuana. Let's talk about the bottom line. Amy, is it safe?
It is absolutely safe. There is no possible chance that you can overdose on cannabis. The worst thing that happens is you get very tired, very hungry, or you have that stoned, heady feeling. All of those things go away with time. Or you can take some CBD, just plain CBD, and help bring down those symptoms sooner.
Sure, and that's really, really important. You are in control. If you're taking medical cannabis and you begin to feel uncomfortable, get some CBD by itself, take an equal amount of CBD to the product that you're taking, and it'll help you regulate or have you get back off of that anxiety or that heady feeling that you have. So you are in control. And I think that's really, really important. And also you can help and find your own relief. You don't need to have other, let's just say, doctors tell you what's there. The doctor doesn't know how your body feels. Your body will tell you. Trust me, in my particular case, I knew when I was getting relief. I think also, Amy, you can't get addicted.
No, and that's really the great thing about cannabis. Unlike opioids or benzodiazepines like Xanax, there is no physical addiction to the cannabis plant. So patients are able to increase or decrease their dose based on how they're feeling. And if they do want to decrease suddenly or stop suddenly, there's not going to be any withdrawal symptoms from stopping.
Sure. And again, as we pointed out by talking about routes of administration, there's more than one way to take it. You don't need to smoke it. And I think that's really, really important. So wrapping up, I should say thank you everybody for watching this particular video. I hope that it's helped you address or answered a lot of your questions about whether medical cannabis is an option for cancer. We would like to be able to naturally point you to our YouTube channel where you can get other videos, this video and other videos on how medical cannabis can help. Naturally tune into the medical marijuana and aware webinars that can help you be able to address, again, get more information on how to address a lot of different situations. Amy, any final thoughts?
Just start low, go slow. Consider using a ratio product of THC to CBD, and just keep track of what you're using and how effective it was for you.
Right. And my final thought is we know it works. I've seen a number of patients use medical cannabis to address cancer. Like any pharma drugs, it's not 100%, but it is an option. It has worked, and it is something that brings a lot of relief, both for the pain, the anxiety, and the stress. So I'd like to thank you all for watching. Please check out our YouTube channels and our medical marijuana webinars, and thank you very much. That was some helpful information on medical cannabis. And Amy, thank you very much for helping me with that. I think one of the questions comes up now is that's a lot of theory. Where do we actually get medical cannabis to help us? And I think that's where Forrest, Manny, and yourself can help us identify some products, and you can find them at your local Surterra Wellness Dispensary, right?
That is correct. There's multiple products, and that's stated in your show just recently, or just seeing if any extra notes were made, so we can kind of guide them along with what the physician wants.
Yeah, you cut out there for a minute, Manny. Can you go back just for a second and repeat that?
That the physicians put in the MMUR, the registry, because there are quite a few products we can use, but it is very specific. Just like it was said within your video, each patient or each customer is going to be different depending on their needs and the symptoms and treatments they're going through.
Sure. Now, is there any take us through a couple of, you talk about the Soothe, the Relief, the Serene. These are products that have multiple terpenes and different ratios.
Absolutely. And one of the primary terpenes you'll find in a lot of the products recommended is going to be caryophyllene or caryophyllene. Is great as an analgesic. It's also, as of right now, the only known terpene that reacts with our CB1 and CB2 receptors rather than just guiding traffic. works as an analgesic. It works great on the gut microbiome, excuse me. So that's a soothe one-to-one. But as stated earlier, we also want to use some high THC products depending on what the symptoms are that that patient or customer is going through. So
Sure.
for instance, we have the FSO or RSO, we call it FSO, full spectrum oil, which is a great benefit because as you stated, it has all the cannabinoids, all the terpenes, all the flavonoids.
Now, what's interesting is when you take a look at these different ratios of products, again, Christina Sanchez was pointing out, if you have a cancer that's related, for example, to the brain, in that part of your body, it's more THC makes sense. Yet she talked about when someone had like breast cancer, how the higher CBD ratio of CBD products make sense. This is where you have both of those in your arsenal.
It is. Like I said, we have the FSO, we have the one-to-one soothe, we have other one-to-one products. We even have one-to-one vape devices. And we also have tools to use to dab or use concentrates as such, if necessary. However, we want to be cautious and cognitive of the different cannabinoids because different cannabinoids can actually play out a little bit differently. So for instance, CBG can kind of inhibit CBD. CBD kind of inhibits THC. You have myrcene, which actually allows the permeability to the blood-brain barrier a lot easier, so you don't need high THC volumes. So there's a lot of different chemistry that's happening, and depending on, again, the patient's needs is how we would direct them.
Well, I think it's important that if someone has a question, one of the things that you offer as Surterra Wellness is consultation.
Oh, absolutely. And for those type of but we want to make sure we get it right because it's more specific. There's a lot of generalities where you can start off new patients with similar symptoms. However, cancer doesn't really play that way. And so one of the terms I like to use is node, the need, the onset they're looking for, the duration of therapeutic effect, and then the effect they're actually looking for. And then from that, I can kind of detect which way they want to go and get them involved in products that will be efficient and effective.
Sure. I think that if someone has a condition, a cancerous condition, I would recommend a consultation right up front just to get the most out of your cannabis product and get the right products for you.
Yeah, and usually when we have patients that say that or have those symptoms, that's what we normally do. We'll take them out to the side and do actual one-on-one consultation. But again, we like to review any notes that the physician put forward because we are not necessarily medical professionals and we don't want to try to step on any physician's recommendations. To that point, some physicians kind of leave it to Surterra to actually kind of guide them that way because the products change so regularly. They're not like your normal pharmaceuticals that kind of stay the same every single way and have the same effect. And so you have, for instance, like Marinol and Epidiolex in your slideshow, synthetic THC and synthetic CBD, but it's missing the terpenes as you suggested as well. So that's like spaghetti and meatballs, but no sauce. Without the sauce, you're not going to get that great flavor. So that's what the terpenes would do, and that's what we use in order to direct them.
Right. And also, I think by not having the terpenes in those products, you're not necessarily getting the maximum benefit of using that particular product to address cancer. It does work, but it could work better with the terpenes. So, and you've seen a number of patients actually come in and work with you on with respect to cancer.
Oh, all the time. Yeah, on a daily basis. Some are very energetic, some are enthusiastic, some are optimistic, some are really down in the slumps. And that's what I mean by it's very, you got to be very respectful of each individual's needs. Some don't mind being out in the open during a consultation, some need a more private consultation, and we offer both to the convenience of the patient.
Sure, that's great. Well, listen, let's jump into answering some questions. I know, Forrest, you're going to give out something at the end of this, right? Some credits or something for Surterra. I'm not going to steal your thunder, but let's kind of go through the questions and get onto that. One of the questions is there any guidance around using THC, CBD dosing for hormone-responsive breast cancer? Amy, do you want to take this one? Because I think there really is no fixed CBD to THC ratio, as Christina Sanchez pointed out. it really is individual. But in the case of breast cancer, she was talking about using more CBD.
Yeah, certainly. And it's really just going to depend on what works well for that patient. As with most products, most cannabis products, it is going to be a trial and error to figure out what works really well. But as Dr. Sanchez did say, a little bit more CBD than THC actually worked well, is what they found.
Mm-hmm. You know, are there oncologists who support the use of cannabis for cancer, and how can I find them? I have found that, at least in my practice over the last 8 years, oncologists are becoming increasingly on board. In fact, I'm surprised how many of them are now supporting the use of medical cannabis in the treatment of cancer. So I know it's becoming much more popular. In fact, I'd say most oncologists now support it rather than fight it. But I don't know a source that you can go to. I don't know, Forrest or Amy, do you know of a source that they can go to find oncologists that are cannabis friendly?
I don't have a source that they can go to. I would approach it as just an open and honest conversation with the doctor. Let them know that this is something that you want to pursue, why you want to pursue it, and then kind of gauge how they feel. Not every doctor is going to be on board with it, but at the end of the day, it is a treatment that you are choosing to do.
Right. Good. Now, what is the best route to take cannabis for colon cancer? Is inhalation still effective? I think, Manny, you probably can address this one, because in my opinion, the route of administration really depends if the person is comfortable using it, because if you'll use it, it'll become effective. But if it's something you're not comfortable with, you probably won't take it. But what's your thoughts, Manny?
I agree. Typically, when it comes to situations like this or questions like this, again, we would refer back to the medical marijuana use registry and any notes the physician left or any notes that the patient brought in with them. And as you suggested, depending on how they use it or what they're willing to do, it may or may not be as effective. A lot of cancer patients that do come in, for instance, don't like to use inhalation. Most will associate cancer with lung cancer right off the bat. And even if it is lung cancer, it may not necessarily be the best route, but it's going to be based on the physician's recommendations.
Right, right. And again, there are multiple routes of administration, and I think they're all I would say they're all pretty much equally as effective.
Yes.
Yeah. Do cancer cells have CB receptors? How do cannabinoids affect cancer cells? Man, are you comfortable talking about that, or would you like Amy and I to take on that one?
Yeah, I like to tag on that, and if Amy would like to step on it, I'd be more than happy to learn more. One of the things that we found out, or that studies have shown, is that cannabinoids or cannabis and the entourage effect not only attaches to the CB1 and CB2 receptors and other receptors of cancer cells, initiating that cell death as illustrated in the video, but it also weakens them so that the therapies that are being administrated, such as chemo radiation, are more effective, which in turn may reduce the time that they're actually going through those therapies. And then at the same time, the cannabinoids and the entourage effect is also protecting the cells of our organs and other cells, so that those therapies are not as damaging to our body as it would be without cannabis.
Sure. What's happening is that not only is the killer T cell going in and actually killing the cell itself, but also cannabis has a neuroprotective property. So what it does is, as it coats and as it works with the different cells of your body, it regulates how much energy each of those cells takes, meaning that a regular cell takes anywhere between 20 to 100 times less energy than what's required by a cancer cell. So what happens is, by having all the cells take the same amount of energy, the cancer cell basically is starved, basically dies. And I think that's something that's interesting. There are videos on this, which I find fascinating. Can cannabis help acute myeloid leukemia? Amy, do you have any idea of that one?
Sure. So acute myeloid leukemia is going to be a blood cancer. That's what leukemia is. Cannabis can be very effective for that, as cannabis is transported around the body in the bloodstream. So it can help with that. It may also significantly help with any of the treatment side effects that the patient is experiencing, whether it's pain, nausea, vomiting from the treatment. So as with everything, it is going to take some trial and error to figure out what works well for that patient.
Yeah, that's interesting. It says, I'm going through chemo and having a hard time keeping my weight up. What can I use? What is the best option for helping with nausea. Manny, you want to try that one?
Sure. So there's a couple of products you can use, and depending on the route of administration, whether it's inhalation, oral, sublingual, or otherwise, that would determine which specific product. One-to-one soothe with a high cariophylline or FSO products, particularly high in cariophylline as well. They also are going to be high in alpha bisbolol, if I say that correctly, and terpineol rather than terpinolene. The reason being, terpinolene in conjunction with THC has been shown to actually have an effect of energizing, uplifting type status, which most patients don't want to deal with when they're going through the symptoms of cancer. So terpineol instead has that couch lock effect or more relaxing effect. And it also helps as anti-cancer, and it can help with the gut as well. It works more as an appetite suppressant, just like humulene does. But in the instance of keeping your gut microbiome in status and balancing it out, it works well to induce appetite as well, depending on your symptoms.
Yeah, it's fascinating. A lot of folks using cannabis with chemotherapy have mentioned it helped them get their appetite back. That's one of the related side effects of that. I have multiple myeloma. The early stages cause a lot of pain in the bigger bones, insomnia, brain fog, and inflammation. What should I use? Amy, do you want to address this one, or Manny, do you want to take this one?
Amy, okay, she diverted. Again, this it's not necessarily a blanket recommendation. It'd be more of a conversation that needs to take place. But one of the things that I would recommend for this would be, again, high cariophylline products such as a one-to-one soothe. If you're looking for high THC products, I would recommend some of our relief tincture or Theragels, which has a higher terpene profile that will help with your pain. It'll also help you sleep as well. If you're looking for something for daytime or something that's not really high with the euphoric effect, 5-to-1 serene would work really good with that, especially for the brain fog. The only caveat is, since it's a higher CBD product with not much THC, you would have to take a little while for the full effects to take place, as CBD takes a little while to build up in the system. So we could introduce some THC with that and go back and forth until we get on a higher CBD regimen. But that's the route I would go initially.
Yeah, that's good advice. Says, I got diagnosed with renal cancer, RCC. The studies are there. What studies, research has been done in related to RCC and RSO? Amy, do you want to try that one?
Yeah, certainly. So during the video, I actually saw this question beforehand and I had a chance to do some research. I did not actually find any current research that directly references renal cell carcinoma and RSO. So that's kind of where we are. There just isn't the research for this right now. So I cannot give you any references or any current studies for that. I think
one of the problems we have is because here in the United States, it's a Schedule I drug, we're not doing as much research as we should. And I think that's something that we really have to get rid of, this prohibition, and really get down into studying studying medical cannabis with respect to cancer and other conditions much more effectively. So sorry, we don't have an answer, but hopefully in the future, things will open up and there will be. Next set of questions. How can I find out exactly what products I use to elevate pain from CIPN, interested in tinctures or edibles? Do you want to try that one, Manny?
Sure. Unfortunately, a lot of this is going to be a touch and feel type situation. Most dispensaries offer discounts, new patient discounts, as such as we do, 60% on your new discount or new patient discount. So that way we can get a few products into your basket, kind of test things out, get a journal down, come back or call our assistance line, and that way we can guide you a little bit better. It's kind of hard to just dial right into one particular patient that has the same symptoms as another, even if it's not cancer. So the symptoms that come with this and the symptoms that come with the treatments for cancer can be quite a force to navigate through. So unfortunately, I can't recommend any specific products, but if you were to come into any Surterra, we would sit down, have a consultation, get a better understanding of what you're going through, and then actually be able to direct you towards products that may be effective and efficient.
Right. And I think that especially as with the consultation, I think when you all know it's something related to, for example, breast cancer or brain cancer or something in between, you know exactly which ratio to use, what kind of products to use, and of course, the route of administration is important. Again, this is where a consultation will probably help because every person's different. Every body is different. And so it's important that we get this really fine-tuned for you. The nice part about cannabis is once you get it fine-tuned, it works great. And that's really important to find out. Interesting question. Will there be a webinar in the future having to do with epilepsy and medical cannabis? And the answer is yes. We're planning to put one together this summer, have it available in the fall. There's just been so much published on that. I decided to take on some subjects that really didn't have that much background, but we are getting a lot of questions on it. We will address that and have that in our YouTube library. Recreational use is legal in New York. So why can't doctors prescribe it unless they have specific training? Amy, do you want to try that one? Because I think this is very similar to Florida.
Yes, so this is actually very similar to Florida. Specifically in Florida, doctors are required to take a training course before they're allowed to prescribe or recommend medical cannabis. And this is going to be a state-by-state thing. Because cannabis is still federally illegal, every single state is making their own laws that govern physician practice. That includes whether or not they have the ability to prescribe or recommend medical cannabis. So it's really just going to depend on what that state requires.
Right. And the reason that states are requiring the training is when doctors get their degree, they're not trained on the endocannabinoid system or on cannabis. So they really have little if no training on cannabis. So all the states are trying to do is provide at least some background on cannabis. Most of the state training is on how to fill out the paperwork, but there is some training on the basics of medical cannabis to at least get the doctors started. So what they're trying to do is head the doctors into that educational path by being able to have them get certified with specific training. Well, that's the pre-submitted questions. Let's talk about the questions that came out during the webinar itself. Jay asked a question, is there studies on the interaction of THC and sleep? Last week, we actually had a couple of weeks ago, we had a whole webinar on sleep. And we did talk about with Dr. Greg Holt, sleep medicine studies. And here's a couple of studies that are here. Again, you can use sleep medication with cannabis. In fact, what a lot of people do is they wean themselves off of the sleep medication using cannabis as their primary sleep property that's there. These studies will be forwarded to you as part of the follow-up, Jay, to this particular webinar. Sarah asked the question, does cannabis help more for certain cancers or evenly across the board? Well, I'm going to take a stab at this, and then Amy, I'm going to let you take a stab at this. Maybe Jay, maybe Manny, you can kick in here. First of all, whether it's pharma drugs or cannabis, we're still trying to search for that magic bullet to really address cancer. We know that cannabis has helped with cancers. We know there's a number of pharma drugs that are trying to help with cancer, but we really don't have that black and white situation that we'd all like to have when we have this particular situation. Now, as Dr. Sanchez pointed out, if you have cancer related to basically the CB1 receptor areas, which is your brain, your central nervous system, your spinal cords, things like that, then what you have is a higher THC product will help you. If it has to do with breast cancer or a lot of the tissues in your body, then what you'll find is CBD tends to work best. And that's what the medical researchers are finding out. So there isn't a answer. There's a personalized answer, as she says. Your thoughts on that, Amy?
I actually totally agree with you. And I think it's just reiterating what Manny was saying before. It's just going to take that trial and error to find out what the patient can tolerate as far as products. Because if they're not going to use a product, it's not going to be effective. And then it's just finding that correct dose, that correct ratio of THC to CBD. And from what I know, I have not seen any reports that there are cancers that are not sensitive to cannabis.
Right. Yes. Yes. In fact, it's interesting, surprising how well it works and how little research has been done in this particular area. Now, William asked a great question. Is internal use of FSO good for colon cancer, or will a lot of the product be needed, and in which case, in which cost becomes a factor? Now, we cannot stress more the dosing aspect of this. More is not better. When you find your therapeutic dose, stick with it. Using more of it will probably cause the reaction that maybe isn't what you want, whether that's anxiety, whether that's not feeling well, or actually bringing the pain back that's there. So really the key, number one, is to find your therapeutic level. And I think RSO is a great product. Your thoughts on that, Manny?
I completely agree. I did want to apologize if I cut in and out. I think the storms along the Emerald Coast here have been wreaking havoc on the internet.
Yeah, I
So
think we should point out to everybody, there is some very bad storms in your area. So I think internet's going in and out for everybody.
Well, hopefully everybody's safe. I did want to mention really quick on that last question. It's kind of ironic or coincidental that
it's ironic that he cuts out right in the middle of that, right? Is it? You want to address that, Amy?
Oh, Manny's back.
Okay.
Sorry about that. Okay, so internal FSO or will a lot of product be needed? I'm sorry, the question again, Mark?
Is the internal use of SFO good for colon cancer, or will a lot of the product be needed? And I was pointing out that sometimes more is not better.
Yeah, so that goes to the biphasic effect. Less is always more, finding that sweet spot. That's something we definitely educate and consult when we have patients in the dispensary to show them how to actually do that low and slow, especially orally. Orally is one of the hardest ways to diagnose, especially depending on diet and environment that could play a factor. So always low and slow. And one thing to remember, if you're dealing with solids, unless it's pre-partitioned, like chocolates are, you don't necessarily want to cut gels or other things in half because it may not be homogenized where the medicine's evenly titrated across.
Right.
So
Now, in the
it's
case,
partitioned good.
yeah, in the case of your FSO, which is a syringe, you squeeze out about a grain of rice size dose. Is that correct?
Yes, and that's
In fact, I tend to look at FSOs and
10
RSOs
milligrams to
as,
25 grams, depending.
I'm sorry, say that again, Manny. We lost you for a second.
I was just saying the rice size grain, depending on your rice size grain, is going to be anywhere between 10 to 25 milligrams, depending on how fat you squeeze that rice size grain, which 25 milligrams is not too much. And as Amy stated before, you're not going to overdose on cannabis.
Right. And I think, again, you don't necessarily need to have more, but you need to have the right amount. And that's where going low and going slow is finding out what it is. But I think getting there makes something that's there. And I think Surterra has a number of discounts in play, whether you're seniors, veterans, that also they can take advantage. Is that safe to say, Manny?
Absolutely. We have different profile discounts, but we also have our daily discounts. They can all be seen online.
Yeah. And on a regular basis, it's there. My counsel is to be what I call a Surterra whisperer. Sign up for your emails that come out, and on a weekly and biweekly basis, you get some absolutely great potential discounts that really are coming.
And if not the email, you can always download our app. You can find it in the App Store or on the Play Store as well.
Yeah, that's a good thing that's there. Jessica asked the question: any suggestions on CBD THC use for brain cancer, specifically addressing fatigue and depression? Amy, do you want to address this one?
Yeah, I think it just goes back to what we've been saying. It's absolutely going to depend on what works for you. It may be a higher ratio of CBD to THC. It might be a lower ratio. You may do well with tinctures. You may do well with RSO. It is just going to take that trial and error. And this is where I always recommend using a treatment journal just to track what's effective and what's not, so you really have that solid information for yourself.
Sure. Now, Sarah asked a question. I think, Manny, this is right up your alley. What Surterra product is RSO or FSO?
So our Surterra products is FSO, which is equivalent to RSO. So Rick Simpson oil versus full spectrum oil. We have a sativa blend, an indica blend, and a hybrid blend. And it's only meant to be topically or orally, not meant for inhalation whatsoever. I want to point that out. Very important.
Yeah, good point.
the other thing I want to mention is when coming into a dispensary and dealing with a guide, a in-store guide, you want to talk to them about the symptoms you're trying to treat, not the diagnosis. Okay,
Right.
because if you go in with the diagnosis, you might get a blank look. We're not trained that way. We're trained to treat the symptoms that you're experiencing with cannabis. So just keep that in mind, please. It'll make it easier for all of us.
Great, that really helps. Well, I think that answers almost all of the questions. I do want to point out that if you're looking at getting a medical marijuana card, please look at MMTC of Florida. They have 25 locations within Florida. Naturally, for cannabis products, I recommend and suggest that you go to Surterra Wellness. I think, Forrest, you're opening up a number of locations in Florida. Is that correct? I mean, you already have a number of locations and you're still expanding.
Actually, we have 45 locations in Florida, but no current expansion plans right now. We're working on making sure that we have all the right product in the 45 stores that we have right now.
Well, that makes a lot of sense. But with 45 locations, you're actually in quite a few spots here in Florida. I also want to point out that we do have a My Botanical Wellness site, which you'll see. Really, we're not competing with Surterra at all. We have just CBD products. Some people are looking for where they get CBD products, and the gas station's not necessarily the best place for that. So we can help with that. I do want to mention that if you are looking at addressing cancer or any serious condition with respect to medical cannabis, really talk to your dispensary. Go get a consultation from Surterra Wellness. I think that's probably the best way to go. It's going to be time very well spent, and also will save you a lot of money. I want to thank everybody for joining us tonight. I know it's been a long webinar. We've addressed a lot of subjects. Forrest and Manny, any last thoughts?
I do. I actually have a surprise here. We'd love to award somebody in the audience a $25 credit. So there was a lot of really good information tonight. So what I'm looking for tonight is there was 2 terpenes that Manny had specified were great for some of the symptoms that one can be dealing with. So if you could put the 2 terpenes that Manny listed, as well as your email in the chat, the first person to answer that correctly, we're going to award you a $25 credit. Now, I will say that you do have to have our app downloaded, because that's how we're going to deliver you that coupon. So we have to have our app downloaded, and you have to be enrolled in our loyalty program as well. But as long as you have those things, please send in your email. I see a couple of things coming through the chat. Make sure that your email's in there too, please. So 2 terpenes and your email. That's the first thing that we're looking for.
Well, thank you very much, not only for sponsoring the seminar and the webinars, but also for providing the good information and a little surprise at the end. Manny, any thoughts you have?
I'd just like to remind everybody, again, come in looking to treat your symptoms. And just to name a few at the end of this, pain, chemo-induced nausea or CIN, vomiting, insomnia, appetite, neuropathic or visceral pain, which is to say nerve or organ pain. And we'll be more than happy to assist you with whichever route of administration you're looking to use, and whichever product would be most beneficial and efficient. So thank you, and I appreciate everybody's time and joining us tonight.
Well, thank you, and I hope the storms you don't get any more negative effects. Let's put it that way.
Thank you.
Amy, your final thoughts.
Just always happy to be here and be able to contribute to knowledge. Even if we help just one person, then we've met our goal. As always, please start low, go slow, and always use a treatment journal to at least figure out what's effective or ineffective for you. It's really helpful just to have that ability to look back.
Right. And I want to, first of all, thank everybody for joining us. I know that this has been a long webinar, but one that I think hopefully is very effective. As I mentioned at the beginning of the show, 1 out of every 3 people in the United States will at some point in time have to deal with cancer. And if you take a look at family members, spouses, brothers and sisters, there's a lot of folks, about half the population will have to deal with cancer. And hopefully this provides some guidance to be able to head in the right direction. There's just, you need a lot more research, there's no question, but we do know from the work that's been done so far by people like Dr. Sanchez, by people like Rick Simpson, by a lot of the studies that have been done coming out of Israel, coming out of Canada, that this is an effective option. Please get a consultation from Surterra and start your journey. Thank you, everybody, for joining us. Have a safe weekend, and we look forward to seeing you next week when we're going to be doing dosing. Thank you.